Cardiac glycosides, also known as digitalis compounds, are medications originally derived from the foxglove plant and have a long history in cardiovascular medicine. In modern clinical practice, the most commonly used agent in this group is digoxin. These medications are prescribed primarily for specific heart rhythm disorders such as atrial fibrillation and atrial flutter, where the upper chambers of the heart contract in a rapid and poorly coordinated manner. They may also be used in selected cases of heart failure, particularly when symptoms persist despite other standard therapies. Their use requires careful medical supervision because their benefits and risks are closely balanced. Digoxin works at the level of individual heart muscle cells. Under normal conditions, these cells rely on an enzyme called the sodium-potassium ATPase to maintain proper electrical balance across the cell membrane. This enzyme moves sodium out of the cell and potassium into the cell using energy from ATP. Digoxin partially and reversibly inhibits this enzyme. As a result, sodium levels rise inside the heart muscle cell. This change affects another transport system known as the sodium-calcium exchanger, which normally removes calcium from the cell. When sodium accumulates, this exchanger becomes less effective, leading to an increase in intracellular calcium. The rise in calcium inside heart muscle cells enhances the interaction between contractile proteins. This allows each heartbeat to be stronger and more efficient. Clinically, this translates into an increase in the force of cardiac contraction and an improvement in cardiac output. As cardiac output improves, blood flow to the kidneys increases, which can promote greater urine production and help reduce fluid buildup in the tissues. This mechanism explains why digoxin can relieve certain symptoms of heart failure, such as swelling and shortness of breath. In addition to its effects on heart muscle contraction, digoxin also influences the nervous system control of the heart. It increases activity of the vagus nerve, which is part of the parasympathetic nervous system. This action slows electrical conduction through the atrioventricular node and reduces heart rate. Because parasympathetic input is more pronounced in the atria, these rate-controlling effects are especially useful in atrial rhythm disorders. Would you like to receive the next part of this educational series before we continue? A critical consideration with digoxin therapy is its narrow therapeutic window. This means that the difference between an effective dose and a potentially harmful dose is small. Even minor changes in blood concentration can lead to toxicity. Because of this, patients receiving digoxin require careful dosing, regular monitoring, and education. Factors such as kidney function, age, body weight, and interactions with other medications all influence how the drug behaves in the body. Early signs of digoxin toxicity often involve the gastrointestinal system. Patients may experience loss of appetite, nausea, or vomiting, and less commonly diarrhea. These symptoms are important warning signs and should not be ignored. Digoxin also affects the electrical conduction system of the heart. Excessive vagal stimulation can lead to slow heart rate or impaired conduction between the atria and ventricles, resulting in various forms of heart block. In addition, the increased intracellular calcium that enhances contraction can also increase the risk of abnormal heart rhythms, particularly at toxic levels. Neurologic and visual symptoms are also associated with digoxin toxicity. These may include confusion, difficulty concentrating, disorientation, and changes in vision. Some individuals report blurred vision, double vision, or a yellow tint to objects. Skin reactions such as mild rashes can occur but are less common. In cases of acute severe toxicity, extensive inhibition of the sodium-potassium ATPase can disrupt normal potassium balance in the blood, leading to dangerous elevations that require urgent medical treatment. Management of digoxin toxicity focuses on stabilizing the patient, correcting electrolyte abnormalities, and reducing the active drug in the body. In serious cases, a specific antidote known as digoxin immune fab may be administered. This treatment consists of antibody fragments that bind digoxin and render it inactive, allowing it to be safely removed from circulation. Supportive care and close cardiac monitoring are essential during treatment. Certain conditions increase the likelihood of digoxin toxicity. Low potassium or magnesium levels and high calcium levels enhance digoxin binding to heart cells. Impaired kidney function reduces drug clearance, allowing levels to rise. Several commonly used medications can also increase digoxin concentration by interfering with its metabolism or excretion, including some antiarrhythmic and calcium channel blocking drugs. For these reasons, clinicians carefully review medical history, laboratory values, and current medications before and during therapy. Would you like to receive the next part before we continue? Digoxin is not appropriate for every cardiac condition, and there are specific situations in which its use should be avoided. It is generally contraindicated in patients with certain types of heart block because slowing conduction further may worsen the condition. It is also not recommended for most ventricular arrhythmias since safer and more effective treatments are available. In the setting of an acute myocardial infarction, increasing the force of contraction can place additional stress on damaged heart tissue and may increase the risk of complications. These considerations highlight the importance of individualized prescribing and careful risk assessment. Before starting digoxin therapy, clinicians typically perform a thorough baseline evaluation. This includes measuring body weight, vital signs, and a detailed assessment of heart and lung sounds. The presence and severity of fluid retention, such as swelling in the legs or abdomen, are documented. Laboratory tests play a central role in safe therapy. Kidney function tests are essential because digoxin is primarily eliminated through the kidneys. Electrolytes, especially potassium, magnesium, and calcium, are closely reviewed. Cardiac-related markers and diagnostic studies, such as electrocardiograms and measurements of ejection fraction, provide additional information about cardiac function. Patient education is a key component of digoxin therapy. Patients are informed about how the medication helps the heart work more efficiently and why consistent dosing is important. Taking the medication at the same time each day helps maintain stable blood levels. Patients are advised never to stop the medication abruptly unless directed by a healthcare professional. Learning to monitor one's own pulse is often recommended. Counting the heart rate for a full minute before each dose allows early detection of excessive slowing. Patients are instructed to withhold the dose and contact their healthcare provider if the resting heart rate falls below a specified threshold, often around 60 beats per minute, unless otherwise directed. Lifestyle guidance supports medication effectiveness and safety. Moderate physical activity appropriate to the individual and dietary measures such as reduced sodium intake are commonly encouraged. When diuretics that lower potassium are part of the treatment plan, patients may be advised to include potassium-rich foods in their diet while avoiding unsupervised supplements. Recognizing early warning signs of electrolyte imbalance and toxicity empowers patients to seek care promptly. Muscle weakness, unusual fatigue, gastrointestinal symptoms, or changes in vision should always be reported. This shared responsibility between patient and clinician helps reduce complications and supports long-term treatment success. Would you like to receive the final part before we continue? When digoxin is administered in a clinical setting, especially by the intravenous route, careful monitoring is essential. Before each dose, the patient's apical pulse is assessed for a full minute to ensure the heart rate is within a safe range. Continuous electrocardiographic monitoring is often used to detect changes in rhythm or conduction early. Blood pressure is observed closely and intravenous access must be secure. Emergency equipment and the specific antidote digoxin immune fab should be readily available whenever intravenous digoxin is given. Laboratory monitoring continues throughout therapy. Serum digoxin levels are measured to confirm that concentrations remain within the therapeutic range. For heart failure treatment, lower target levels are typically preferred, while slightly higher levels may be used for certain atrial rhythm disorders under specialist guidance. Electrolytes are reassessed regularly because changes in potassium, magnesium, or calcium can quickly alter drug effects. Kidney function is monitored over time since declining renal clearance can lead to accumulation even when doses remain unchanged. Evaluating therapeutic response is just as important as watching for adverse effects. Effective digoxin therapy may result in improved exercise tolerance, reduced symptoms of fluid overload, and better control of heart rate in atrial arrhythmias. The absence of toxicity symptoms and stable laboratory values indicate appropriate dosing. Quality of life measures such as reduced hospitalizations and improved daily functioning are also considered markers of success. From a broader clinical perspective, digoxin illustrates the balance between benefit and risk that characterizes many cardiovascular medications. Its mechanisms are well understood and its effects can be valuable when used in the right patient population. At the same time, its narrow margin of safety demands vigilance, education, and collaboration between healthcare providers and patients.